SCAG. Welcome to this roundtable discussion on the art of utilizing data and technology to quantify the impacts of COVID-19, SCAG's Vulnerability Indicators Dashboard. As other speakers have noted, this crisis has revealed and in many ways exacerbated existing disparities and inequities in our communities. And as speakers in the last session were discussing if we're to build a more inclusive Southern California, it's imperative that we identify social, health, and economic indicators to inform policy responses to those most impacted. And we're so grateful to have our colleague Tom Bowe, who has dedicated so much time and energy over the last few months to develop a tool that does just that. Tom is a senior regional planner at SCAG. He works in the research and analysis department, where he applies his research, spatial, and analytical skills to diverse topics related to transportation and land use planning that promote sustainability and equity for Southern Californians. Tom works on a number of topics, and just to name a few, these include job accessibility, open space accessibility, vehicle miles traveled and time travel reductions, urban runoff pollutants, affordable housing, general plan updates. He does it all, and we're very excited to hear more about this tool that he's developed. There will be time for questions following his presentation, so please put your questions in the chat box, and I'll go ahead and get started.
Hello, thank you, Meg. Good afternoon, everybody. So thank you for the kind introduction. Seems quite long. Seems like I've been doing a lot of things, but not really. I've been learning a lot, and I was fortunate enough to get the support from our leadership and my manager to get to work on these important projects. So as Meg mentioned, the presentation for today is going to be focusing on how we utilize data and technology these days to quantify the impact of this COVID-19. And I'm going to go over some basic information background, and I'm going to, towards the end, I'll give you a live demonstration of this dashboard. So for those of you who don't know about SCAG, so I'm just going to briefly go over some background information here. So SCAG stands for Southern California Association of Governments. We are the nation's largest metropolitan planning organization, and I'm sure you've been hearing this all over the conference. But we are in terms of population size and land area. So for population size, we have now a little bit more than 20 million people. That's almost 50% of the state of California's population. And we are located in Southern California, as you know, covering 6 counties and 191 cities. So the 6 counties that you're seeing here on the right, on the map to the right, in the blue area there. So we have Ventura County, Los Angeles, San Bernardino, Orange County, Riverside, and Imperial County. And within the SCAG region, we have 15 sub-regions. And as you know, there are 2 major products that SCAG produces every 4 years and every 8 years. And the big ones, the first one I'm going to talk about is the Connect SoCal. It's also known for the Regional Transportation Plan Sustainable Community Strategy, RTP-SCS. And the other project, which is major and also important project, is the Regional Housing Needs Assessment. I'm not going to go in detail about this project because I assume that you already know, and we've been talking a lot about these 2 projects, but they are significant and regionally significant projects. And here are our vision and mission. So for SCAG's vision is Southern California's catalyst for a brighter future. And our mission is to foster innovative regional solutions that improve the lives of Southern Californians through inclusive collaboration, visionary planning, regional advocacy, information sharing, and promoting best practices. And the reason why I'm bringing these, the mission and vision up is because of these mission and vision. We have been using this to create a lot of innovative tools, solution analysis, and information value-added products to our stakeholders, to all the residents and our cities and counties in the region. And as the result, this product is one of that And I also wanted to use this opportunity to advertise or bring up this 2020 regional guide. For those of you who would like to learn more about SCAG and know some of the important and interesting statistics in the SCAG region, you can feel free to take a look at this slide, or you can also get the PDF version online. It's right located in the contact section right there. There's a link that you can go online and get it. And this is the second page of the regional guide. As I mentioned, it provides a lot of useful information such as existing land use and commuting patterns, commuting characteristics, active transportation, bus, land area, and rail. So I apologize for the long introduction about SCAG and some of our major products, but it's important to know the background and context before we can start talking about the SCAG vulnerability indicators dashboard. So I'm going to go quickly over the facts and basic information of COVID-19 because I'm sure that you've been hearing a lot about it through social media or the news. And so what is COVID-19? Its full name is coronavirus, and it was founded in 2019. So that's why it's called COVID-19. And it's an illness caused by a virus that can spread from a person to person. And the symptoms can range from mild to or no symptoms at all to severe illness. And when was this the first case of COVID-19? The first case was reported in Wuhan, China, late December 2019. And how did this COVID-19 happen? Currently, we don't know the actual cause for this pandemic or virus yet, but the public health official and partners are working hard to identify the source of this of coronavirus. And the first infections were linked to a live animal market. And the last question that I also want to talk about is, how has COVID-19 been impacting our lives and communities? And I think this question is no-brainer because, as you know, it's been impacted on a wide range of areas, including public health, transportation, housing, public finance, and the economy. And for the next several slides, I'm just going to give you some applications and data and out there that have been already made accessible to the public. And currently, you can also go to you can Google coronavirus, and you can get so much information. And there's so many from many trustworthy sources. And so in the next several slides, that's what I'm going to do. And for this one is the information is from the New York Times. This website, I have the link down there for you to go on the website, but it has provided a lot of information related to COVID-19 around the world, and also all the news and information that's necessary for you to know. And as of today, we have 8.3 million plus total cases around the world. And out of those, we have 449,179 plus deaths. That's an alarming number, and that number is not decreasing. Another application that I'm showing you right now is from, this is one of the most popular applications out there, is from the Johns Hopkins University. And as you can see, this application provides important statistics such as the other one around the world, states, and counties in the US. So on the left chart there, you can see the top 50 confirmed cases by county as of today. And on the right side, you see the top 20 counties by number of deaths. And at the bottom, you also see the cumulative bar charts of all these confirmed and death cases that are happening. And as of today, in the United States, we have more than 2.2 million total cases of coronavirus. And out of these cases, we have 112.9 thousand plus deaths. And what's unique about this application that you're seeing here is now you can actually go, you can go to this application, click on any counties that you want, and it will have a pre-made report that provides a more that provides a closer look at some of the interesting and important statistics, such as healthcare facts, population by race, or the number of cases in that particular county. And now I'm just gonna dive into a more granular level of the data by drilling down to each county and other important variables. So the state of California has developed a daily report on daily report of key statistics from this pandemic, which are the number of cases broken down by age and gender. It also provides as well as hospitalizations. And the governor and his team has been using these numbers to determine the phase of reopening for California. So as you can see here, each county public health department has done such an outstanding job at providing as much information as possible related to the pandemic to their residents. However, other data such as the people who are severely impacted by this pandemic at the jurisdictional level may be hard to find. For instance, what about the property sales and hotel tax revenues that each city generates? Or which city have high population of senior, or the people without insurance, or which cities have high number of low income and overpayment households? These information could be important for our residents, frontline workers, and policymakers to make more informed decisions. So if you all agree with all these questions that I just asked are important, then you are at the right place, because SCAG has collected, organized, compiled, and developed a dashboard to show you all these key vulnerable indicators for every single cities, for all 191 cities and 6 counties in the region. But before that, let me talk a little about the impacts of COVID-19. So the chart on the left shows the unemployment claims nationally. Over the past 12 weeks or so, approximately 44.2 million claims. Even though the claims are decreasing, but the future is uncertain. And that might raise another question. What if the unemployment claims run out? And you have probably heard it from some of the speakers earlier. And what if we are gonna have the second wave or third wave? And as you know, you've seen a lot of spike in cases in other counties, in other counties or states. And another important and alarming statistics are the COVID-19 death rate per 1,000 by race and ethnicity. You can clearly see the disparity between African American and other races, and this is directly related to environmental justice and public health issues. If you take another look at the number, African American population is only 13% of the total US population, but their share of COVID-19 death is almost double. Therefore, it's important that we pay a close attention to these vulnerable populations. And this is why this dashboard is important. This is another look at the impact. So the chart on the left is showing the mobility trend from Apple, and the one on the right is also using a GPS and cell phone data to track the activity level from SafeGraph. And as you can see, from the Apple mobility trend, you can select multiple different locations, but I selected California to show you. So based from the point that the state has locked down, that's around mid-March. So you can see the activity level has decreased roughly 60%, and it's been recovering slowly and basically already kind of surpassed the baseline because of the reopen, because we are reopening our economy. But you can see the potential loss there. You can see the potential impacts. So on the chart on the right, showing these activities broken down by different major destinations, and you can see that a lot of the biggest impact from COVID-19 is happening at the movie theaters and airports, and so by using these data, you can make a better informed decision. And for this one, I also wanted to use this opportunity to talk a little bit about the recently published white paper about economic impacts in our region. And this white paper provides two separate analyses conducted by SCAG staff, which present an initial statement of potential employment and taxable sales implications of the COVID-19 pandemic. So for more information, you can visit the link right below to get access to the PDF report of this white paper. All right, so now I hope you have all have a good idea of COVID-19 and how this pandemic has been impacting us. Now, I think it's time for us to talk about the SCAG vulnerability indicators dashboard and how this is important for local jurisdictions and stakeholders. At the high level, the dashboard includes more than 70 indicators of potential vulnerability at the jurisdictional level. So that's at the city and county. Focusing on social and health, economy, and housing. And the purpose of this dashboard is to provide context and insightful information for local jurisdictions and stakeholders to better understand the impact of this pandemic. So as mentioned earlier, a comprehensive list of vulnerability indicators has roughly more than 70 indicators, variables from many sources, ranging from the Census American Community Survey to California State Controller's Office, Info USA, and the California Tax Credit Allocation Committee, Department of Housing and Community Development. So let me go through each of the indicator and give you a whole tour of what variables we have included in this dashboard. So for the category, economic category, we have residence-based employees. So these are the people who work in these sectors, in different job sectors that live in the city. We also included workplace-based employees. So these employees come to work in the city from in different job sectors, but they may live outside of the city. And then we also included several tax tax revenue information here, such as property tax, sales tax, and also hotel taxes revenues. And for the health category, we have employment status by disability status, health insurance status, and the likelihood of health conditions of adults and seniors. So for the housing category, we have household by income distribution as comparing to the county annual median household income. And we have also included occupied housing units by tenure, that's owner and renters. And then also the severely cost burdened households that pay more than 50% of their annual income to mortgage or rent. Severely overcrowded household as well, and these households that have more than 2 persons per room. And the last one is the high segregation and poverty area for each city. And for the last category, we have the social category here. So we have age composition by different age groups. We also included median household income by tenure, property status in the past 12 months, public assistance income or food stamps, and ratio of income and poverty level. And the last two important variables are total housing units and total population. In the next two slides, it's just basically the same information that I presented earlier, but it gives you a better, a more detailed description on the data, just in case that you don't understand the variables labels. You can always refer back to this a slide to understand more about the definition. And these information are also provided on included in the link in the dashboard, so you can also download it, the methodology document and also the data behind it. So in summary, most demographic and socioeconomic data was obtained from the Census American Community Survey. The data was compiled and organized in Excel for the whole SCAG region. So as you can see, there's a lot of computation power and a lot of work to obtain, collect, and organize the data into a presentable format so that we can provide this data set to you and also develop this in the application. The second one is the tax revenues data and this data was obtained from the California State Controller's Office. It was post-processed to each city and county in the region and also we have selected key tax revenues such as retail, property tax, and hotel tax. And the last one I want to point out is the employees by sector data. It was obtained from the Info USA, which is a proprietary source. We have also utilized statistical analysis software to post-process for those highly impacted sectors, because this data is really big and is considered as one of the big data out there. And so we have to use a lot of specialized software and cross-platform to process. All right, so now that we have learned about what COVID-19 is and talked a little bit about about the data and variables that are included in the dashboard, now it's time for us to look at the dashboard in life. So now I'm just gonna, so every information that I presented here today, I have also included the link at the bottom, so you can always refer back to this slide, and I think it's gonna be available later. You can also click on it and it will take you directly to the website. So let me share my Chrome. I already have it open. All right, so I think you all can see my screen. And so after you click on the link, this is the first landing page that you will see. And it's very clean and simple. At the bottom of the page, you will see disclaimers and information text that, just generic information to welcome to this page. And also if you have any questions related to this dashboard or any data related to this dashboard, feel free to email me, and my email is right there. And you can also download the data dictionary that has methodology and as well as the data description and variables that I talked about earlier. And right now this data is actually live, so you can actually download it through our SCAG Open Data portal, and this is the direct link that you can download, and it's available at the future class shapefile. So you can actually map it out, or you can do some spatial analysis if you want to. And another thing that I want to mention is right now the dashboard is more compatible with other platform besides Internet Explorer. So now let's talk about how you're gonna use this dashboard. You can actually select the county, and when you select the county, it will basically sort it out just only those jurisdictions within the county. Or if you don't want to do that, you can also type in the city that you like. And before I do that, I'm just going to show you also the base map here, there's a lot of base map. And if you're familiar with SRE products, usually they only give you, I think 6 or 8 base map, but I'm really surprised that they give you a lot on this one. But I just want to quickly show you that my personal favorite is the modern antique map. It looks beautiful and it looks presentable, and with this you can also you can always take a picture, screenshot, and pop it into your presentation, into your slideshow, and then you can do a presentation about this. So now let me just go to a city, and I'm going to select the city that I live in, which is Buena Park. So it will zoom into that city, and all you need to do is click on this link in the pop-up window right here. So after you click on the link, it will take you to another page, and this is the SCAG vulnerability indicator dashboard in 3 different pages. We have 3 different pages focusing on social, health, economy, and housing. So let me just go through each of the pages so you have an idea of what kind of variable inside included inside. So at the top, if you notice, we have selected out all these key statistics, and this information will be available across all pages. And you can see from the left to right, the total population, housing units, median household income, senior population, households that receive food stamps, as well as sales and use tax revenues. On the first column here, and here you can also see the map. You can zoom in and zoom out. If you kind of forgot, where the jurisdiction is located, you can also zoom out and check its location. And when you're done, you can click the home button, and we'll take you back to that area. And down here you can see the population by age in different age group: under 5, 6 to 17, 18 to 64, and 65 plus. And in the middle column, we have the disability population, and in different categories: not in labor force, unemployed, and employed. And we also have insurance coverage population, without insurance or with insurance. And for the local jurisdiction, you may want to focus on the population without insurance. We also have population poverty status by so this is basically a ratio between the ratio of household income divided by the federal poverty level. So here you can see it's been categorized as doing poorly, struggling, poor or struggling, or doing okay. And on the left column, you will see the likelihood of health conditions for seniors 65 plus, and also adult 18 to 64 population. And the information that you can see here is the likelihood of all these chronic disease, such as obesity, high blood pressure, heart disease, and diabetes type 2. And this is the second page of the dashboard, which is also important because it provides all the key information related to the economy. So the table that you're seeing here is the residence-based employees. You can actually mess around with the table by sorting the values from largest to smallest to largest, or by alphabetical order. So what I'm just gonna do here is and then also another option is you can actually select the top or the bottom jobs. So for this case, if I put 5, it's gonna show me the top 5 jobs in this city. And with that, you can also change the data visualization here to different bar charts or pie chart. I'm just gonna go with the horizontal bar chart here. And you can see it's nicely designed. And at the bottom, you will see the workplace-based employees. So similar function to the other one, you can also change it to another style. So I'm just gonna do that the same. And as you can see here, for the workplace-based employees, we have already selected out the most impacted sectors for this particular city. They are retail trade, accommodation and food services, art, entertainment and recreation, other services without public administration, and transportation and warehousing. And on the top of that, you will see tax revenues, and these are selected tax revenues in the city, and we have the total tax revenues, and also sales tax, transit occupancy, that's hotel tax, and we also have property tax as well. In addition to that, we have also calculated the percentage of these revenues comparing to the total tax revenues, so that you have an idea at the right away what's the percentage or the share of the tax revenues. And these could be potential and these could be vulnerable because, as you know, since the lockdown, there's a lot of businesses been closed down, and retail, restaurants, and so on. So this could give you an idea of how much revenues you are losing. And this is just, and this is the last page. We're focusing on housing. As you know, housing is very important and is never been more important than now, especially for those who are renting, not only just for not only for housing, but also for businesses because of the pandemic. So a lot of them are struggling to pay rent because they may have lost their jobs and so on. So this page will be dedicated to all the housing related information. So we have occupied housing units by owner and renter. We also have overcrowded housing units, as mentioned earlier. So these are severely overcrowded housing units that has more than 2 persons per room. We also have the cost burden housing units that pay more than 50% of their household of their income. And in the middle column here, we have households below poverty level for married couple, and as well as single parents by owner and renter. And on the last column, on the column to the right, we have the high segregation and poverty area in acres, and as well as the city total acres. So when you look at this, you will have an idea what's the share, or how large, what kind of high segregation or poverty area you have in your city. And the last chart that we have here is, which is also important, which is the household income distribution based on county annual median median income. And based on this information, you can see the households that falls within each category. And the categories are extremely low income, very low income, moderate income, and above moderate income. So based on this, you will have an idea. Okay, so if you have a lot of households that falls within the extremely low income, or the very low income, or even the low income, then maybe this is an indication that you may have to worry about in your jurisdiction. So this is pretty much the overview of the dashboard, and another thing that I forgot to mention is you can also export these dashboards into images or PDF for your presentation. You can also print it out, and they have different settings and options there, so it's really easy to use. and you can just go back and forth here. Okay, so that's pretty much the end of my live demo for this dashboard. So let me just go back to the presentation real quick. All right, so this is just the screenshot of those dashboard, but that's it for my presentation today, and I would like to end it here and take any questions.
Thanks, Tom. We have a couple of questions coming in. The first is from Axel Olsen, who asked, what was the staffing effort to develop this, and is it at all Esri as far as the API plotting libraries?
So the development process was actually, we basically developed a list of variables that we think are vulnerable from news media and articles and so on. So it was basically not, we didn't really use API for this purpose. So we basically downloaded and from the ACS from several websites, because as you know, the data also not only the data comes from ACS, but we also have data from state controller office and other sources. So we need to do additional work, processing work to put the data together. Once we put the data together in a presentable format, then that data that we also have to develop a data dictionary and methodology for our IT to understand and work on this data, so they can also work together to develop this dashboard.
Okay, another question from Linda is the data available at smaller geographies than citywide?
The data right now is only available at the citywide, because some of the data is not available at the census tract level, for example. So basically, the tax revenues are not available at the census tract or even smaller than citywide level. But we do have plans for the future improvement to actually drill down to a granular level, such as census tracts. Actually, that was one of my I had another slide to talk about the improvement, but that's also another improvement that we're thinking about. And just going back to the other question that he mentioned about the API, I think that's a good point. And if you use Esri product right now, Census, they made it very easy to grab into the API, and you can actually grab that API on the Esri Atlas. And so it's really easy to do. And so because of the timing and everything, so we just compile and download it the data. But that's going to be the future improvement, where we're just going to connect directly to Census API and process it, and somehow also develop some sort of mechanism to translate other sources, other data into the format that we want. So that's going to make it a seamless process.
Great, thank you. Laura Mail has asked, does the data cover unincorporated areas?
Yes. So when I mentioned county, that's unincorporated area. So you can also have the data for all counties, but we actually calculated, we actually process for unincorporated area as well. Yes. So if you download the data today, in the data column, there's a city name, a jurisdictional name. There's also you can see unincorporated area right there.
Are there any other questions? We do have a bit more time for a discussion. Anyone would like to talk about anything?
No, it kind of went over a little bit fast. So.
Okay, we have a couple more. Is there a data dictionary?
Yes, so the data dictionary, you can download it on the website. So let me just show you to do that. Show you how to do that right now. So when you click on the link in the presentation, so at the bottom here, so right here, it provides you all this information that you need to know. And this is, if you click on here, sorry, it's kind of, so make it larger. So if you click right here, that's gonna take you to the data dictionary to download. That's the PDF. And this is also the, let me see if I can click on that. Okay, there you go. So this is the data dictionary, as well as the methodology. So, you know, similar information that I presented earlier. Similar information that I presented earlier in the presentation. So data category, variables, and also the year and the sources, and as well as the data dictionary or description, if you may. So this is the methodology and data description. And if you click here, you can also download the data. So you click on that link, it will take you to our SCAG Open Data portal, and you can find this database here, and you can actually use API, or you can download it in whatever format that you want. And this is just to kind of give you a quick overview of the database. And we have county, we have sub-region, we have city, as well as city full name and the acres. And this is all the variables we have in here. So as you can see, there's a lot of them. Yep.
Okay, another question is, have you thought about doing change over time?
Yes, definitely. Because the data that we have collected is basically pre-COVID. And we would like to keep improving this dashboard and keep collecting information, or maybe even, you know, post-COVID and keep it going, to keep track of these indicators in the region.
Okay, I'm not seeing any more questions come in. There's not a closing session after this. It just, the conference will conclude after the session. So last opportunity to raise any points.
Well, if you don't have any questions right now, you can also contact me with my email there. It's basically vo@scag.ca.gov, and I will answer your questions or provide you any information that you like.
Looks like we have one more. Was this a board-directed effort initially, Tom?
It was half-half, because I would say, because I work in the research analysis, and I do a lot of GIS and you know, research on new policy and anything new that's happening in the region. And so housing has been one of my projects. So I've been doing a lot of research and data pulling on that. and as you know, you can see a lot of housing data in there, as well as, you know, environmental justice and public health. So when this topic came up, when this thing came up, you know, we felt like there's something that we got to do. And as you know, there's so much information out there, but there's not a lot of information related to vulnerability indicators. I mean, I'm pretty sure you've been hearing, you know, you know about the disadvantaged communities, County Vital Screen, and Healthy Place Index. I mean, those are great websites, but they also don't have other information like tax revenues or the number of jobs that work in the city or that live in the city. So we kind of started the process to work on this, to work on this data. At first, it was just data development, and it turned into a dashboard. And we also have, you know, our new president, SCAG president. His name is Rex Richardson, and also our directives, you know, from we also have support from Sarah Jepson, that's our planning director, and Komi Chise, that's our executive director. So they see that this is an important topic, and this is something that we can do as the region, because we have so much data, we have so much knowledge and expertise, and we've been working with many stakeholders. So we felt that this is something that important to do. And now what you're seeing here is basically the first, the version 1.0, I would say, and it's gonna keep improving over time. Oh, I see we have a lot more.
We have a couple more, yeah. So let's start with, is there a reason why some variables are from 2017 ACS while others are 2014 to 2018 ACS?
Yeah, so like I said earlier, we have collected a lot of new information, but we also have a lot of information we already have collected for our internal, also other projects such as RENA. So I was able to use some of the data from another project. Well, in terms of, because we only show the percentage for a certain data source. So for the 2013 and 2017 ACS, we only show, that's only used for overcrowding and cost burden data. And we only show the percentage, so it didn't change much over time. So that's why we decided to include it. But in the future, we're gonna keep the data as up to date as possible. And if you notice, some of the data we have in there is also 2016 as well. So this is also another thing that we need to discuss, and so we can improve. But you know, some data are hard to get, some data are very expensive, and we try our best to bring all this data together in a way that it would create value added product.
All right. Is there any interest in showing the variables by race and ethnicity where data is available in the ACS?
Yeah, we originally we did have that in mind, but we do have one variables in the dashboard, basically showing the highly segregated area and poverty area. So based on that data is kind of taking consideration of area where is overly concentrated with minority population and low income. So that one is kind of cover the EJ communities, you know, in the city. But yes, in the future, we're gonna keep expanding or organizing the data in a way that that we can also put those important data in as well. And another thing that I also want to add to, since we're going to talk about the improvement, I have a list of things that I want to improve for this application. First of all is you know, we can also add the number of confirmed cases, death by county. You know, when you click on the website, when you click on the first landing page, or the hospital locations, as well as testing locations. So that's on the mapping application, but on the data on the dashboard, we're also thinking about adding race, ethnicity, as well as transportation related, maybe those households without vehicles, or those house or public usage, public transportation usage. So those kind of things. Yeah. But if you know, if you have any suggestions or data that you would like to add or improve, or anything that will make this application better, please feel free to email me, and I would love to have those comments, because what we're trying to do here is we're trying to provide something that's helpful for our local jurisdictions to use.
Looks like that does it for questions, but thank you for everyone who posed those questions. Those were great. Anything else, Tom, before we wrap up?
No, that's it for me. And thank you everybody for your attendees. And I hope you had a great time with this 31st annual demographic workshop. You may have seen me around. I mean, if this is your second time or third time attending, you probably see me around because every year I always help out or I do something there. But it's nice to see you again virtually, and hope you're doing well and safe. That's it for me.
Thanks, everyone. Have a great day.
Thank you.